Welcome to PAF COVID-19 Basics for You. From Awareness to Action. This program aims to educate people like yourself on the essentials to control and prevent the spread of COVID-19. In this course, you will learn how disinfection originated, how respiratory infections are transmitted, the core elements of the cycle of infection, and tips on protecting yourself from acquiring disinfection. From Awareness to Action. Step 1. Awareness, how it all began. Understanding modes of transmission of respiratory infections. Step 2. Education, 6 core elements of the cycle of infection and your role in breaking that cycle. Step 3. Action, skills you need to prevent spreading and contracting the virus. From Awareness to Action. Step 1. Awareness, understanding modes of transmission of respiratory infections. Step 1. Awareness. How is the course designed? This course includes video-based learning, and you can press play to start watching it. At the end of every level is a quiz to check your understanding of the concepts covered. Best of luck. Step 1. Awareness, understanding modes of transmission of respiratory infections. Virus and respiratory infections. Okay. So let's begin by defining a virus and a respiratory virus so we can understand them better. A virus is an extremely small piece of organic material regarded as a non-living thing that causes diseases in humans, animals and even plants. Antibiotics don't affect a virus and hence are not used. A respiratory virus is a small organic material that infects the lungs and airways. It may cause a respiratory infection, which tends to affect the normal function of the lungs, causing problems in breathing. A respiratory illness arising from a respiratory virus can range from a common cold or pneumonia. In most people, symptoms tend to be mild. What are the identified sources of transmission? Coronaviruses are zoonotic, meaning they are transmitted between animals and people. They can spill over from animals to humans, humans to cats, humans to dogs, humans to humans. So if you are sick with COVID-19 or are at risk and you have a companion or pet animals, be sure to limit your contact. Implement basic hygiene measures when handling or caring for animals. What is COVID-19? COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China, in December 2019. COVID-19 is now a pandemic affecting many countries globally. Coronavirus consists of a core of genetic material surrounded by an envelope of protein spikes. These give it the appearance of a crown. Crown in Latin is called corona. Short for corona, virus vi. Disease D is COVID. Its discovery in the year 2019 gives it the number 19, hence COVID-19. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, dry cough, and tiredness. Other symptoms that are less common and may affect some patients include aches and pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell or a rash on skin or discoloration of fingers or toes. These symptoms are usually mild and begin gradually. Some people become infected but only have very mild symptoms. On the bright side, most people, about 80%, recover from the disease without needing hospital treatment. Older people, and those with underlying medical problems like high blood pressure, heart and lung problems, diabetes, or cancer, are at higher risk of developing serious illness. These infected particles can live in the air for a long period of time, and can be blown over great distances. Airborne transmission. Airborne transmission occurs when small particles suspended in air, less than 5 microns in size, containing the virus are inhaled into a person's respiratory system. Contact transmission. Contact transmission occurs when there is a physical contact between an infected person, contaminated object and another person. This can happen either through direct or indirect contact. Droplet transmission. Droplet transmission happens when an infected person coughs, sneezes or talks, and tiny drops from the infected person enter another person's eyes, nose and mouth. What is the mode of transmission of COVID-19? There are primarily 3 ways that COVID-19 can transfer. What to do in case you have symptoms. If you have minor symptoms, such as a slight cough or a mild fever, there is generally no need to seek medical care. Stay at home, self-isolate, and monitor your symptoms. If symptoms are worsening and causing discomfort, seek home care services. Seek immediate medical care if you have difficulty breathing or develop pain or pressure in the chest. Coronavirus is a large group of viruses which includes many such as severe acute respiratory syndrome, SARS, Middle East respiratory syndrome, MERS and novel coronavirus COVID-19. 1. True. 2. False. Check your understanding. Question.
Hi, I'm Dr. Shamsa. I'm confused about the given statement. Can you tell me the right answer?
True.
Oh, great. So it's a group of viruses. Thanks.
Check your understanding. Question. A couple of days ago before I got ill, I developed symptoms of fever, cough and shortness of breath. I had shook hands with my friend who had COVID-19. What kind of transmission method is this? Droplet. Contact. Airborne.
So, what do you think? Contact.
Check your understanding. Question. A couple of days ago before I got sick and developed symptoms, I remember that a lady sneezed standing near to me at work. This is how I believe I contracted COVID-19. What kind of a transmission method is this? Droplet. Contact. Airborne.
So, what do you think?
Droplet.
Wow. So you mean that if someone sneezes or coughs, without covering in an elbow, that would make it a droplet transmission? Thanks.
Check your understanding. Question. A couple of days ago another incident took place. I remember sitting in a room with a lady who was singing loudly. I could even see drops coming out from her mouth as she sang. But I was sitting far from her. My doctor thinks even at a distance, I contracted the virus from the virus suspended in the air. What transmission would that be? Droplet. Contact. Airborne.
So, what do you think?
Airborne.
Hi, I'm Dr. Shamsa. I've recently recovered from COVID-19, but I am still confused about how I got it. Can you answer this for me, please?
Step 2. Educate. 6 core elements of the cycle of infection and your role in breaking that cycle. The cycle of infection. A cycle of infection refers to the path that viruses take to enter a person and to be transmitted from one person to another. Transmission occurs when the agent leaves its reservoir or host through a portal of exit, is conveyed by some mode of transmission, and enters through an appropriate portal of entry to infect a susceptible host. This sequence is sometimes called the chain of infection. That means, we can stop the cycle. 6 elements in chain of infection. Do you ever wonder about how you got ill? The first element in the chain is an infectious agent, which can cause a disease. It could be a virus, bacteria, or fungi. The second element is the reservoir. The reservoir of an infectious agent is the habitat in which the agent normally lives, grows, and multiplies. Reservoirs include humans, animals, and the environment. Then we have a port of exit. Portal of exit is the path by which a pathogen leaves its host. This can happen through the mouth by coughing, through the blood if cut, or through feces by toileting. 6 elements in chain of infection. Do you ever wonder about how you got ill? The next element is the mode of transmission, which is how the infectious agent is transmitted from one person to another. It can be through direct transmission or indirect transmission. Direct transmission involves transmitting an infectious agent from a reservoir, person, to a susceptible host, person, by direct contact or droplet spread. Direct contact occurs through skin-to-skin contact, or touching frequently touched objects, for example phones, doorknobs, etc. Droplet spread refers to spray with relatively large, short-range aerosols produced by sneezing, coughing, or even talking. 6 elements in chain of infection. Indirect transmission refers to the transfer of an infectious agent from a reservoir person to a host person by suspended air particles, airborne, inanimate objects, vehicles, or animate intermediaries. Airborne transmission occurs when infectious agents less than 5 microns in size are carried by dust or droplet nuclei suspended in air. Vehicles refer to indirectly transmitting an infectious agents through food, water, or inanimate objects such as handkerchiefs, bedding, or surgical scalpels. Vectors such as mosquitoes, fleas, and ticks may carry an infectious agent through purely mechanical means or may support growth or changes in the agent. In the case of COVID-19, mosquitoes are not known to be carriers of the virus. 6 elements in chain of infection. Do you ever wonder about how you got ill? The 5th element in the chain of infection is the port of entry, or the place where the infectious agent enters another person's body. This is similar to the port of exit. It can be a mouth, nose, eyes, etc. Finally, we have a susceptible host. It can be anyone. But people with weak immune systems due to old age or diseases put them at greater risk. Break the cycle and you will break the infection. Check your understanding. Question.
Hi again, Dr. Shamsa. Remember how I contracted COVID-19 from a lady singing loudly in a room I was in? What is the portal or exit in this example? The lady's mouth? My mouth? The room? Let's recall what we have learnt.
The lady's mouth.
Oh, I remember now. Portal of exit is the path by which a pathogen leaves its host. Thanks.
Check your understanding. Question.
Hi
Direct
again,
transmission,
Dr. Shamsa.
indirect
If I
transmission
contract
vector,
the virus through a
indirect
bedsheet or a
transmission
scalpel,
vehicle,
this would
let's
be called. Recall what we have learnt.
Indirect transmission vehicle.
Wow. So transmission through inanimate objects such as bed sheets, scalpels and handkerchiefs is called indirect transmission through vehicles. Thanks.
Can we break the cycle of infection? Yes, we can. Each and every one of us can do our part to slow and stop COVID-19 from spreading. How to protect and prevent. Protect ourselves and our loved ones through simple and practical changes to our daily behaviors and routines. Practicing good hand hygiene, hand washing. Cough and sneeze etiquette. Practicing social distancing. Cleaning and disinfecting our environments. What is the best way of practicing hand hygiene? Frequent hand wash, especially after touching objects. The WHO, World Health Organization, recommends washing your hands by following the 7 steps shown in the image and video below. How to use a hand sanitizer. Remember that the best way to ensure clean hands is by using soap and water for 20 seconds. However, if you don't have access to soap and water, using hand sanitizer containing at least 60% alcohol is a great way to ensure your hands are clean. The video below shows how to use hand sanitizer correctly. You should follow the same steps you do when washing your hands. Cough etiquette. These simple steps can help to reduce the spread of COVID-19. Cover your mouth and nose with a tissue when coughing or sneezing, and dispose of the tissue immediately. If you do not have a tissue, sneeze into your elbow rather than your hands. Wash your hands with soap and water immediately as described in previous slide. Keep your environment clean. Ask yourself this. How many times do you touch your phone, your office or toilet doorknobs? Do you wash your hands after it? To break the cycle and prevent infection, it is important to be more mindful about the surfaces we touch at a high frequency and to keep those surfaces clean. There are a number of ways to keep your surfaces clean and disinfected. How to prepare your own disinfecting solution at home. You can also use a regular household disinfectant or using an alcohol spray of at least 60% alcohol. Both can be purchased at any grocery store. Social distancing. Social distancing, also called physical distancing, means keeping a safe space between yourself and other people who are not from your household. Tips for social distancing. Arrange and prepare, wear mask, for a safe transportation. Limit contact with people when running errands, for example 2 meters away. Choose safe social activities, for example video chat over gathering. Keep safe distance at social gatherings or during outdoor activities, for example 2 meters. Check your understanding. Question 1. What is the best way to ensure your hands are clean? 1. Apply enough hand sanitizer and rub the palms of your hands together. 2. Wash your hands with soap for 20 seconds in the same way you wash them with soap and water, by following the 7 steps. 3. Use hand sanitizer for 20 seconds. Wash your hands with soap for 20 seconds in the same way you wash them with soap and water, by following the 7 steps. Check your understanding. Question 2. What is the best way to cough? 1. Cover your mouth and nose with a tissue when coughing or sneezing and dispose of the tissue immediately. 2. Cough into your hands. 3. Cough into your elbow. Cover your mouth and nose with a tissue when coughing or sneezing, and dispose of the tissue immediately. Check your understanding. Question 3. What practical steps can you take to protect and prevent from infections? 1. Hand hygiene, cough etiquette, cleaning surrounding environments and hand rub. 2. Hand hygiene, cough etiquette, cleaning surrounding environments and social distancing. 3. Hand hygiene, cough etiquette, cleaning surrounding environments and hand wash. Hand hygiene, cough etiquette, cleaning surrounding environments and social distancing. Check your understanding. Question 4. What type of transmission is prevented with regular cleaning of your everyday environment? 1. Direct contact transmission. 2. Indirect contact transmission. Indirect contact transmission. Check your understanding. Question 5. If you must go out, how big should be the distance between you and other people? 1. At least 1 meter. 2. At least 6 meters. 3. At least 2 meters. At least 2 meters. Step 3, Action. Skills you need to prevent spreading and contracting the virus. When are masks recommended by WHO? Medical masks are recommended primarily in healthcare settings, but can be considered in other circumstances, see below. Medical masks should be combined with other key infection prevention and control measures, such as hand hygiene and physical distancing. You should wear a mask if you are a healthcare provider caring for potentially sick patients. You are sick and exhibiting symptoms of COVID-19. You are taking care of a person at home who is sick with COVID-19. What is an N95 mask? An N95 mask is specially designed to filter airborne particles. It needs to be fitted properly to ensure its effectiveness. Purpose: prevent inhalation of airborne particles that may contain infectious agents. Usage: when there is air pollution such as haze, caused by minute particles in the atmosphere. N95 masks are recommended for healthcare workers. What is a surgical mask? A surgical mask has 3 layers. 3-ply WHCH serves different functions: outer layer, flood repelling. Middle layer, barrier to microorganism entry. Inner layer, moisture absorbing. Purpose: provide barrier protection against droplets including large respiratory particles. Usage: protect both residents and healthcare professionals against possible respiratory infection. Surgical masks are recommended for those who have infections or those looking after close contacts with infection at home. Check your understanding. Question 1. What will happen if all healthy people start wearing face masks? 1. Everyone will be safe and the spread of COVID-19 will stop. 2. COVID-19 will continue to spread and we will have fewer and fewer healthcare workers to care for us. COVID-19 will continue to spread and we will have fewer and fewer healthcare workers to care for us. Check your understanding. Question 2. You may be advised to wear a face mask if 1. You are sick with COVID-19 or another respiratory infection. 2. You are healthy but scared of getting sick. 3. You are caring for sick people in your home or in the workplace. 3. You are caring for sick people in your home or in the workplace. 1. You are sick with COVID-19 or another respiratory infection. Check your understanding. Question 3. In a case where one family member is suspected with COVID-19, the following actions are recommended when cleaning your home. 1. Put on a 3-ply surgical mask. 2. Clean common areas with alcohol-based cleaning agents. 3. Open all windows. 1. Put on a 3-ply surgical mask. 2. Clean common areas with alcohol-based cleaning agents. 3. Open all windows. Check your understanding. Question 4. Choose the correct actions of putting on a surgical mask. 1. Cover your mouth, nose and chin, with the colored side face outwards. 2. Cover your mouth, nose and chin, with the non-colored side facing outwards. 3. Pinch the metal edge of the mask so that it rests snugly on the nose bridge. 1. Cover your mouth, nose and chin, with the colored side face outwards. 3. Pinch the metal edge of the mask so that it rests snugly on the nose bridge. 1. 3-ply surgical mask. 2. N95 mask. 3. Motorcycle helmet. 4. Scuba diving mask. Check your understanding. Question 5. To prevent the spread in the community, what type of mask would be suitable to be used by someone who is suspected to be infected with COVID-19? 1. 3-ply surgical mask.